And now we will be going forward with the University of Minnesota.
Hi, everyone. I'm Amanda. I'm going to get my slides pulled up here. Okay, does that look okay? And can everybody hear me? I'm going to take that as yes. So I'm Amanda Day. I am one of the fourth-year residents at the University of Minnesota, and I'm also one of the chief residents. And tonight we also have Dr. Brian Tonkin and Dr. Michael Wynn with us. Dr. Wynn is on call, so hopefully he is on home call. Hopefully he doesn't get paged away and can join us, but I will have them go ahead and introduce themselves now.
Hi, I'm Mike Wynn. I'm one of the PGY4s, just started as a co-chief with Dr. Day. Yeah, I'm currently at home taking home call, so if I get pulled away, please excuse me.
And I'm Brian Tonkin. I'm the program director. I'm also at home, but I'm not on home call. And so we'll be able to tackle any questions that you would like to put in the chat feature. And this is Lyndon. She's a PGY -20, so.
Hey, awesome. Thanks, guys. So seriously, if you have any questions throughout, we'll try to get to some questions at the end. But if you have questions throughout, Dr. Tonkin and Dr. Wynn are here to answer. So feel free to just drop those in the chat. And then once again, I'm Amanda Day. I'm there in the middle. So I'm going to talk to you a little bit about our program. There's a lot to cover with everybody's programs, of course, in 20 minutes, so we will do our absolute best. And thanks to PM&R Scholars for hosting this, and thank you all for being here. We really appreciate your time. We know it's a difficult and different year for interviewing, and we really appreciate things like this that can happen. So with our program, we have 5 spots available each year, 4 of them being categorical and 1 of them being advanced. We have 6 rotation sites and 42 faculty throughout those rotation sites. And then we also have fellowships available in several PM&R fields, so brain injury medicine, pain medicine, peds, spinal cord injury, and hopefully sports medicine soon. That has been in the works. So we're excited about that. We'll jump right into talking about our categorical intern year. So if you did match in one of those categorical positions, you'd be doing intern year here in Minneapolis with us. You would do that at 2 different sites, which are shown here on the left, the VA Medical Center. That is where you would do 8 to 9 months of your intern year. And then Hennepin County Medical Center, which is in downtown Minneapolis and is a level 1 trauma center, you would do 3 to 4 months there. And this is a bit of a breakdown of that intern year schedule. So on the left side is what the rotations that are available at the VA. You do almost all of those. You kind of get a choice a little bit down here, sometimes between cardiology and pulmonology, depending on your interests. And then on the right are rotations that you do at Hennepin County Medical Center. 1 lucky resident each year gets to do general surgery. So might be lucky, might be unlucky to some, but not everybody does that. 2 things that are pretty unique about our program during your intern year is that we have Wednesday morning didactics for 4 hours, protected time every Wednesday with all of our residents. They are attending and resident led, just depending on what's going on. For the most part, I would say attending led, but we invite our interns to those. So interns are required to come, PGY 2 through 4 are required to come, and that really gives people a whole extra year of didactics to start to learn PM&R and to become involved and to get to know your co-residents and the attendings that you'll be working with for the next 3 years. So pretty awesome thing about our program. And then technically, there's no call during intern year. At the rotations at Hennepin County, you do work some nights and weekends, and you do work some weekends on internal medicine too, but you're never taking really like hospital-based or home call. I mean, you need your pager, it goes off when you're on the rotation, but no formal call. And then for a majority of our talk, we'll focus on those other rotation sites and what rotations you do at each of these sites. So one unique thing about our program is that we do have so many sites. A lot of our rotations are done at the VA and then several at the university and then sprinkled throughout a couple different sites. And this really gives us a experience with a wide variety of clinical settings like academic versus private versus government, and helps to kind of see where maybe you want your career to lead you. This is an example of a schedule that you might have as PGY2 through PGY4. As you can see in the PGY2 year, a lot of these rotations are inpatient, which is pretty consistent with PM&R programs in general. We have a clinic rotation in this example because we try to make most PGY2s have a clinic rotation to have that kind of break up in their year of heavy inpatient. PGY3 year, you'll do mostly outpatient with a little bit of inpatient, and then PGY4 will be mostly outpatient with a little bit of inpatient. And then home call is what we do in our program. Like I mentioned, no real call intern year, otherwise it's home call, and it's about 3 weeks when you're on inpatient rotations per block, and 2 weeks when you're on outpatient rotations. Each of our blocks is 10 to 12 weeks long. So 5 blocks total in a year, and most of our residents really enjoy this because it gives you a good chance to kind of get settled in at your rotation site and really get to know your faculty and your patients and staff well. We'll jump into our rotation sites and talk about the University of Minnesota Medical Center. So here you'll do a couple of different rotations. You'll rotate in our outpatient clinic, which is in our clinic and surgery center, which is this beautiful new building here that was just built a couple years ago. Rotate through a variety of PM&R specialties there. You'll also do acute inpatient rehab at our 36-bed rehab unit. The University of Minnesota Medical Center is pretty unique because it's split by the river, and so there's an east bank and a west bank, and so the clinics and the inpatient are on different banks. In inpatient, I mentioned transplant and LVAD here because those are unique patient populations that we see at the university that we don't really see as much at our other sites. And then we also do more of a consult-based service, which also does some outpatient. A stroke center of excellence, we mentioned, that is what the University of Minnesota is. And so a lot of our consults are strokes, but also all of the other inpatient rehab things and consults that you would get. Oh, and our outpatient clinic is, you get a lot of Botox experience here. We in general do at many of our sites, but the university is really well known for that. And I think I met my numbers in like 3 or 4 weeks there, which is pretty awesome. We have no problems meeting any of our procedure numbers at any of our sites in any requirements. Next, I'll talk about Regions Hospital, which is in St. Paul. And so this is a level 1 trauma center. We do an acute inpatient rehab rotation here. There's a 21-bed unit there. A meal stipend is given at Regions, which is a nice bonus that we don't get everywhere. And then outpatient clinics. Outpatient clinics at Regions are usually some of the residents' favorites. A lot of procedures, a lot of general rehab, and really awesome doctors that we work with at Regions. And then the Minneapolis VA Medical Center. So I mentioned that we do a lot of rotations here. Your intern year, you would have 8 or 9 months here, which is a large chunk. And so that intern year, you really do get to know the hospital, the lay of the land, what kinds, doctors from all the other medical specialties. You make friends from the other residencies. So you feel pretty comfortable at the VA from how much time we spend there, and contacting other specialties while you're there through your PGY2 through 4 years is pretty easy. And so that's nice to have that continuity. At the VA, we have an acute inpatient rehab unit. It's a 24-bed unit. There are 3 services there: TBI, stroke, and amputee. And uniquely about the TBI service especially, we have an emerging consciousness program at the VA. Also, the Minneapolis VA is only one of 5 polytrauma sites in the country, so that allows us to have a unique patient population that not even every VA gets to have. And then there's the TBI fellowship, which spends time at the VA, which I had mentioned before. We also have the Spinal Cord Injury Fellowship, and they spend some time here as well as our other sites, and we do a spinal cord injury rotation at the Minneapolis VA Medical Center. It's a 30-bed unit, so that's completely separate from the acute inpatient rehab. The Spinal Cord Injury Center here is one of the 25 national hub sites, and then there are other sites that are spokes that are sent to the Minneapolis VA as the hub. And then there's also opportunity for outpatient clinic at the Spinal Cord Injury Center, mostly doing like baclofen pump refills and everything. So that's where we get a lot of that experience. And then we do several outpatient rotations at the VA. Our pain medicine rotation is usually touted as a favorite amongst residents. We have a fellowship program that I mentioned. They take 4 fellows per year. This year, we have 2 of our graduates going into it. Last year, we had 1 of our graduates. And so they have a really robust didactics curriculum that they allow residents to come to. While you're on the rotation, it's required. And then if you're interested, you can kind of pop by anytime. All of the attendings come and the fellows, and that happens 2 to 3 mornings per week. They also have an interdisciplinary clinic, which I feel like is very unique. They have acupuncture, chiropractor, pharmacy, PT, OT, and then a lot of the medical providers are trained in a background of different specialties, so anesthesia, internal medicine, neurology, and so it's a pretty unique bunch of people that we really enjoy working with. You also have the MSK and the amputee rehab clinic rotation, which is kind of combined. Dr. Tonkin, who is with us tonight, and Dr. Sink really lead that MSK part. There's a lot of ultrasound and procedures involved. And then the amputee rehab is ran by 2 other physicians. And we do clinic time with them and also inpatient consults. At this time, there's weekly ultrasound didactics currently that are a journal club that we do over Zoom, but previously there were journal clubs as well as in-person every Friday morning ultrasound didactics at the VA, so hands-on, and you don't have to just be doing this rotation to come. Anybody can come that is a resident here. And then we have EMG 1 and 2, which is fairly unique, where we have the EMG 2 resident is pretty responsible for teaching the EMG 1 resident. Of course, the attendings are there all the time. We work with about 5 different attendings on this rotation, but the EMG 2 and 1, they work really closely together to learn together. And then didactics for this rotation has become pretty robust as well. It's twice weekly, and that's just really changed a lot over the last couple of years. I will mention med students are very common to work with at the VA as well as the University Medical Center. I've been asked before by medical students now who are interested as residents in giving back and working with medical students. So the VA and the U is where we see a lot of those, and then some go to Gillette as well. So Gillette is a very specialized children's hospital. These are our current fellows. They take 2 fellows per year. And we do an inpatient rehabilitation rotation with Gillette. It's a 16-bed unit, and we work with those fellows and the attendings. There is also opportunity for clinic exposure and operating room exposure at Gillette too during your rotation. And then you can do extra time there if you're interested during your elective and as a continuity clinic, which we will talk a little bit about as well. But if anybody is interested in peds, I would really recommend looking into Gillette more. It's a very unique hospital that does a lot of amazing things that's really well known nationally and globally. I've had patients from all over the world come for their services when I was on rotation there. And then we have Hennepin County again. So we mentioned that during intern year, this is the level 1 trauma center that is in downtown Minneapolis. The other one that we mentioned was Regions, that's in downtown St. Paul. So nice to have those level 1 trauma center exposures. They have an 18-bed inpatient rehab unit that we rotate at. And then they also have outpatient clinic and consults. So inpatient consults, and then the outpatient clinic is general rehab, Botox, EMG, TBI should be on there too, and then ALS. And so this is the main site where if people are interested in getting ALS experience, they have a really good interdisciplinary clinic at Hennepin County. Our last site that we will touch upon is Courage Kenny, and this has just been a site for us over the last year to year and a half, and it's been a pretty amazing experience. I think almost every rotation resident that has rotated through here has just absolutely loved it. And so I'm actually currently there now, and I'm at Abbott, which is a hospital in Minneapolis. They have a 39-bed acute rehab unit. And then the other part of the rotation, you go to United, which is in St. Paul, and there's a 16-bed acute rehab unit there. Then they also have a transitional rehab program in Golden Valley. It's very spinal cord heavy too, focus, which is awesome. And so there's 44 beds there. And then they have a really robust adaptive sports program. So we try to work with them and volunteer with them as much as we can. They're kind of the gurus of that in town. And then moving on to elective rotation. So your elective rotation comes at the end of talking about all these sites, because this is something that you could do at any or all of those sites. It's very individualized. We encourage residents to build their own and try to really tailor it to what you want to do for your future fellowship or career, or just try things out if you're kind of uncertain. Typically, electives are done in the 3rd and the 4th year. It can be worked out to be different timing if people need to do that elective prior to fellowship applications and such. So we work with people on it, but very individualized. There's a potential for an away rotation portion if you're doing some kind of audition, or if you're trying to explore something that we maybe don't have here in the Twin Cities. There's also opportunity for international focus, which I know we wanted. We had somebody who wanted to do that. I'm not sure it'll happen now due to the pandemic, but definitely very open to that during normal circumstances. And then opportunity for research focus, which kind of leads us here into research. Research is obviously a part of every residency program. It's important, but some people want to focus on it more than others. With us, we have every other Thursday afternoons dedicated to research, and then the alternating Thursday afternoons dedicated to continuity clinic time. So this is only during the outpatient rotations during your PGY 2 through 4 years, and you pick it based on your interest and availability. We also do quality improvement projects, which are a requirement, and that has become a group quality improvement project based on your groups are your classes. And so that's something that's just started with my class actually. And then besides all of our rotations, what else do? We try, we do a bunch of stuff with work. Residency takes up a lot of time, and it's something that we're all trying to study for, we're going to work for, but we try to get involved in our community and other fun activities as well. We have involvements in disability advocacy, adaptive sports, sideline coverage, different volunteering. I was told yesterday that there's an adaptive fitness center idea that's like fresh, hot off the press, coming at the university. We work with Courage Kenny that I mentioned, who has the really robust adaptive sports program. And we try to volunteer within our community. We get a lot of questions about sideline coverage, and that is something that this picture here kind of helps show. So we work with a local high school and cover their high school football games, and also do athletic training room coverage. So good amount of coverage there. And then there's all kinds of races and events throughout the Twin Cities that are intermittently being covered. And then additional involvements, the list is endless. I kind of crowdsourced people from our program to see, what else could I add to this, but there's just so much. So the educator track is something that we should definitely touch upon. It's started over the past couple of years. It's additional lectures, assignments, and projects geared toward preparing residents that are interested in entering into academia, or at least an educator role after residency. And that's been taken on really well by those that are involved. For research, we're looking at developing a research track and other tracks that kind of help guide people along and really focus their residency in specific areas if that's what they're interested in. Muscle is a new ultrasound longitudinal experience curriculum. We have a ton of ultrasound exposure, but this is something that's a little bit more formal and starting next month. I'll mention, because Dr. Tonkin and Dr. Nguyen are on here, they are part of medical school admission interviews, which is pretty awesome. Here is a picture of us providing education to medical students. We are part of their
And that's
ultrasound.
time for the session.
What?
That's the
Oh,
end of the
sorry. I was doing my time, so I'm off on yours. Okay, well, I will go forward then. And this is where you can find us. So I apologize that I couldn't finish. There's a bunch of fun pictures here. My clock was at 18 minutes, so sorry. Thanks, guys. But this is where you can find us. And we have Minnesota Monday coming up in August. So come find us there.
Excellent. Thanks so much. And